In health news this morning, the U.S. Surgeon General, Dr. Vivek Murthy, is warning about an epidemic of loneliness. More than half of Americans report feeling lonely, and this is having a significant impact on public health. Murthy released an 81-page report Tuesday saying that loneliness or isolation could be as deadly as smoking 15 cigarettes a day.
Loneliness is associated with serious health risks. The risk of anxiety, depression, and suicide go up when you're struggling with social disconnection, but also the risk of heart disease and dementia go up as well.
Murthy hopes that the report raises awareness around loneliness, and he's urging people to take some time out of their day to reach out to someone in their life and spend less time on their phones. Here to talk more about it with us this morning, Dr. Susan Bleasdale. She's the Chief Quality Officer for the University of Illinois Hospital and Health Sciences System. Doctor, thank you for your time. What do you think is contributing to this loneliness epidemic?
Well, I think we're at the tail end of the pandemic, and I know on May 11th, this ends the public health emergency, but we have seen a lot of the separation that happened by what initially was needed from a social distancing standpoint, but I think that, that sort of exacerbated some of the challenges of just being disconnected as a community and individually. And that definitely, I think, is contributing to this loneliness. And as Dr. Murthy highlights, can lead to increased stress hormones that can put you at risk for complications such as heart disease, as he mentioned. It's really important, I think, to think about this right now. Right now is Mental Health Awareness Month. And so I think it's important that he's highlighting it so that as we are coming out of the pandemic, we can reconnect as a community for our mental health wellness, but for our physical health as well.
And based on the research and what you're seeing in your own practice of medicine, is there a certain group that is more impacted by some of these lonely feelings?
I think we've seen through the pandemic that across all age groups were impacted. Leading into the pandemic, we've had issues around our youth being affected and having a crisis of mental health and suicides as well. And, other contributors are social media and technology that, again, as Dr. Murthy highlighted, is some of the potential barriers or walls that we have between us where we are disconnected as a community, although we are connected by technology and social media, but those are not physical connections.
And finally, on this topic, what is the treatment for loneliness? I know it can be complex, but what would be the first step?
Right. I think the important thing is making connections. For people that are suffering from loneliness and especially other mental health issues that can come from loneliness, such as depression or anxiety, it's important that you see your physician because the physician will make sure that you get connected with the appropriate therapist or psychologist. Sometimes people need medication, but things that people can do on their own is make sure that they're physically connecting with others and engaging in activities where they are engaged with others.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.